Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to have as our guest Jody Hatcher, CEO of Morrison-Dixon and current chairman of the Healthcare Distribution Alliance. Jody, great to have you with us.
Jeff, great to be here. Thanks for having me.
Maybe you could start by just telling us what your view of HDA, the state of HDA is, and your priorities as chairman.
Yeah, and first and foremost, what I can tell you, Jeff, is that HDA is as strong as it's ever been in terms of its membership, its engagement. So during my tenure as the chair, my hope is that we can really focus on three key things. First and foremost is engaging our member distributors and partners in support of the HDA mission and plan. Engagement, as you well know, is the lifeblood of any association, and it's certainly true for HDA and its members. Secondly, as you well know and have talked quite a bit about, successful implementation of DSCSA across all entities of the supply chain is really our second priority here with HDA. And then last but not least, as I mentioned here at the onset, truly communicating and reinforcing the vital role that distributors play in the supply chain. What folks don't always understand is that we are a hardened network that's irreplaceable. And we do a lot of the dirty work in getting products to the patients that need those products. So again, the criticality of our role is important to communicate.
You say folks don't understand. Is that other healthcare providers? Is it politicians and regulators? Is it the public?
In some cases, we've been lumped in with GPOs or lumped in with PBMs. And the fact of the matter is, we're truly a network, a hardened network of 38 distributors who do what other folks can't do or don't want to do. And we provide significant value both upstream and downstream. So again, making sure that we tell our story and letting people know that, much like the highway system in this country or the interstate system, we do a lot of good things for the country, but oftentimes go unnoticed. But what I was going to mention here from a policy perspective, we've obviously got a new administration in Washington. We've got a number of returning legislators to Capitol Hill. We've also got to make sure that in this policy environment we're dealing with, that leaders in Washington understand what we do. What we want them to know is that distributors really have an enduring and irreplaceable role in the pharmaceutical supply chain. And as I mentioned a few minutes ago, nobody can do what we do. The other thing that's always interesting about our role is that we take on more risk than any entity in the supply chain. We store the product, we house the product, we return the product, we got to make sure that the cold chain supports the product. All of those things are mission critical for getting these products to our patients. And then ultimately, at the end of the day, we connect and deliver life-saving medications to our pharmacy patients. And at the end of the day, patients are ultimately at the heart of what we do.
The industry does such a good job, I think it's taken for granted.
And I think that's where we just need to make sure that, if what do they say in Washington? If you're not at the table, you're likely on the menu. We want to make sure that we're communicating what we do and the value that we provide upstream and downstream.
You mentioned the Drug Supply Chain Security Act, which is being implemented. When do you think that work will be finished?
Yeah, it's a great question, and it's obviously top of mind for us from a prioritization standpoint. And as you may or may not know, healthcare distributors have been really at the heart of working with the FDA on traceability issues for about 2 decades. And our goal remains the same, and that's to ensure that the safe and effective implementation of DSCSA, not just with the distributor community, but also upstream and downstream. This is an industry issue, and that's the way we've come about attacking the issue. But to your question, and with respect to timing, the most critical deadline as we see it is May 27th of 25. And that's when the manufacturers and repackagers are going to have to meet the criteria for interoperable data at the package level, or have those waivers or exemptions in place. And obviously this is an important indicator of readiness, not only for the manufacturers, but for those distributors and dispensers in the preceding months. And then ultimately for us, the distributors, the key deadline is August 27th. And that's where we must, we're going to have to receive and trace product from the manufacturer and provide data downstream to our dispensers. So again, really critical that we are synchronized up and down the supply chain here. The other thing I would comment on is HDA has also been played a pivotal role for all of the distributors and even the manufacturers, both in terms of coordinating with FDA, but also coordinating and sharing best practices among the distributors. DSCSA is not a point of competition for any of us. It's a regulatory requirement. And so we want all of our colleagues, despite the fact that we compete with one another, to be compliant, because it impacts the patients at the end of the day.
What will happen if certain parties are compliant on the dates and then others are having trouble getting there?
Well, I think there are remedies in place on DSCSA, in terms of just the implications, and I think all of us are ready for that. So what I can confidently tell you is that I do think all of the distributors are ready. And I think if we have any gaps, it likely may be on the manufacturer side. Obviously, we're working to remedy all of those, but ultimately what will happen, as you well know, is product will be quarantined in the event that they're not ready. And again, we're working now feverishly directly with manufacturers where we do have any kind of gaps in data, as we're testing the data that they're sending us to get those resolved prior to the dates coming up. So again, we'd like to hope as we get further into this, and just given the time that we've all invested, that we should be in a really good place here. Again, from an HDA standpoint, from a Morrison-Dixon standpoint, we don't want anyone in the supply chain to have a bump in the road on this. It's just not in the best interest of the industry.
Based on 2 decades of work and the experience so far, are there changes that HDA would like to see in the legislation?
Jeff, it's a great question, but I think this is a success story, quite frankly, in terms of industry collaboration with the FDA. And so as you sort of step back and look at what's occurred over the last many years, HDA and its distributor members have been directly engaged with the FDA on adapting and modifying elements of the regulation to make sense for all constituents. Even if you look at the extension that was provided last year into 2025, the HDA team was directly involved in helping to drive that. And so I would anticipate as we move forward with DSCSA implementation, we're going to continue to have to adapt. But again, this is a situation that has worked well from our vantage point.
High drug costs remain a challenge for everyone. Also, access is becoming increasingly problematic in light of all the pharmacy closures we've experienced. What's HDA doing to try and help alleviate those two problems?
Yeah, it's a great question, Jeff. And as we step back and think about what we do, the reality is that the viability and relevance of our customers is critical for all of our members. It's not good for the distributors if we have pharmacies that we support that are closing. And collectively, as you think about it, chain drug, independent, specialty pharmacies comprise more than half of our members' customer base. And then the other thing I think is important to note as we think about this broad issue with our pharmacy customers is that the role of pharmacies as a discipline has been elevated in the last several years. Coming out of the pandemic, pharmacies are doing more. They're supporting their communities with access and doing a lot more than just dispensing drugs. So that's a wonderful thing, but at the same time, losing a pharmacy, leaves a hole in the marketplace. It leaves a hole for our consumers and for the patients. And as you think about it, without question, all of these pharmacies are facing numerous challenges: reimbursement, access, the high cost of drugs, which are stressing this segment in big ways. But as we've engaged from a distribution standpoint, we've engaged in a variety of efforts to help our customers survive and hopefully thrive in this difficult environment. As we think about it, we've been taking steps to help our customers by doing a number of things. First and foremost, advocating for reasonable reforms, that can improve reimbursement for our customers. That's one of the biggest issues, as you well know. We've been working with our trade partners through our contracting efforts to make sure that there are fair share allocations of short product that's available for our customers. We've also been advocates for driving accountable behavior among all of the parties in the supply chain, because that's also been an issue around some of the shortages. Around the cost issue, obviously, every one of us have been working to leverage our scale to try and negotiate lower costs for our customers. It's obviously in our best interest to help them. We've also invested in value-added services, from drug spend management and also financial assistance offerings for patients. And then lastly, we've also involved ourselves in initiatives to utilize data to identify potential vulnerabilities in the supply chain and improve resiliency and access. But at the end of the day, our customers are really important, critically important, and we're committed to ensuring and helping our customers navigate some of these challenges. We want to be their partners. We want to work alongside them. We want to understand their challenges and also, pivot where we need to help them.
Jody, you referred to the new administration earlier. How is HDA going about the process of building strong relationships with the new healthcare team that President Trump has put in place?
Yeah, Jeff. I mean, obviously, we're early in this administration, early in this new Congress as well. But first and foremost, we at HDA, we're paying really close attention and engaging the administration as well as Congress to help them understand, some of the healthcare policy issues that are ultimately related to what we talked about a few minutes ago, which is access, affordability, and resilience. These are the things that are mission critical for our industry. And also they're mission critical to strengthening the pharmaceutical supply chain. And while President Trump has announced a multitude of broad tariffs over the last many weeks, he has also signaled potential tariffs which could dramatically influence pharmaceuticals. And again, that's a concern. Our goal and our position at HDA is to prevent any unintended consequences of any potential tariffs or any other legislative moves. And so to that end, we've done a number of things. We have respectfully urged caution on instituting, pharmaceutical tariffs, because as you well know, the U.S. could see new or worsened shortages of critical medications, just given the global nature of pharmaceuticals and associated API that goes into those products. This is a global market, as you well know, and that's not something that you can change overnight. We've also asked the administration to consider establishing some exemptions for pharmaceutical products and longer implementation timelines for any onshoring of product, just given the complexity of manufacturing pharmaceuticals in this industry. So again, those are some of the asks that we've put out there. As I mentioned earlier, we've also been working around redundancy programs to mitigate any potential impact here as well. And then lastly, at the end of the day, from an economic perspective, I would tell you that distributors as well as our generic manufacturer partners just simply can't absorb the potential rising costs associated with tariffs. In our business, we have huge fixed costs associated with our distribution networks, and we operate on a very low profit margin, less than 1%. So absorbing tariffs would just really not be feasible for this part of the industry. But again, we want to be constructive partners in Washington with the new administration and really helping to educate and help folks understand and then find solutions to some of these issues.
So as I hear you talk, it sounds as if increased tariffs would increase drug prices for payers.
That's our concern, Jeff. It's not only, the potential impact on drug pricing, which is a major issue for, everyone in this country, but it's also access. Whether it's some of our oral solid medications that are dispensed through our retail channels, or a lot of the injectable products that are life-saving medications. We don't need more shortages of many of these products. Patients rely on them. And again, we've seen, I think right now, if you think about it, I think there's just north of 300 short products. And again, we don't need to add to that or make that number worse.
As you talk about the potential impact of tariffs, it reminds me that after COVID, there was quite a bit of discussion as to whether the supply chain, the broad pharmaceutical supply chain, as you say, which is global, needs to be brought back to the U.S. or closer to the U.S. What's come of that talk?
I think it's a mixed debate at this point, Jeff, in terms of just the disposition of, pharmaceuticals. There's a lot of political rhetoric, but as a practical matter, we have a worldwide global supply chain in pharmaceuticals. Pharmaceuticals are not just used in the U.S., they're used, throughout the world. And so, again, I think you're going to see more movement towards domestic manufacturing. But at the same time, recognize that there's a lot of international manufacturing as well. As I mentioned earlier, one of the bigger issues is the vast majority of API, regardless of where the product's manufactured, is sourced, overseas. Mm-hmm. And that's another area that we need to address is, those APIs need to be domesticated in some way, and that's not something that can be done very quickly or easily. So again, we need to be very measured, I think, as an industry. As I mentioned earlier, from a policy standpoint, we've got to educate and help the administration and the Congress avoid unintended consequences. It is complicated. As you well know, this pharmaceutical industry is not simple, whether it's reimbursement or pricing or distribution or manufacturing. And I think our job is to convey the complexity and then the implications associated with change.
Jody, you obviously have a lot on your plate as HDA chairman. You also have a lot going on at Morrison-Dixon. Maybe you could tell me a little bit about that before I let you go.
Yeah, I'd love to. Morrison-Dixon, I've been here about 4 years, and it's a terrific organization. It's the second oldest business in Louisiana. It's 184 years old. But since I've been there, we've really been growing the company, expanding the company. Historically, the company had been a regional player. Proud to say today that we are a national player. We are operating and selling into 50 states. We've expanded our breadth and depth, especially into the specialty market. We have made a couple of acquisitions that make us more value to our trade partners. And quite frankly, we are a really good, viable alternative in this marketplace. At the end of the day, I think you'll recognize, and your readers and listeners will recognize that competition is important. And we believe that Morrison-Dixon is a viable competitor in this marketplace, and one that will be growing and expanding and showing up at the doorstep of many of our potential prospects out there.
Well, I appreciate you sharing your insights with me. Good luck with your work at HDA and Morrison-Dixon. It's been great, Jody. Thank you.
Wonderful, Jeff. Great to see you.